48.
What would you say your health was like before you got the treatment?
As far as my feet, they was, it felt like I had no circulation in my feet. I
So
couldn't,
were they numb?
they was tingling. They felt like they was asleep. I couldn't stand for anyone to touch them, or when it first got like that, I couldn't wear heels. I didn't have any balance. But that passed. But they were still numb. I couldn't walk with my shoes off. I always had to have something on my feet.
So was that a part of your daily routine is to wear heels on a regular basis?
I've always worn heels.
You were mainly used to wearing flats, even in the house, on the carpet.
Right, and it, like I said, it passed. And that was on one leg, on my left foot. It started in my left foot, and it gradually went over to my right. Well, as far as walking, I didn't like walking upstairs. I didn't like walking at all. I dread to get up in the morning to just walk because it hurts. I mean, if you've ever had your feet to fall asleep and you tried to walk on it, you know how it feels. That's the way it constantly felt. I mean, I wore heels, but it was just an uncomfortable feeling.
When you went to the doctor, what was your prognosis? What did they tell you?
Before I had the
Before
treatment?
the treatment, what did they tell you about your condition?
Well, she said I wasn't getting any circulation in my feet. That's why I had the tingling. My white blood cell was not working because diabetes kills your white blood cell. And that was it. The previous condition of both my feet, they was tingling, they hurt, I couldn't walk on them. They was talking about, they said if it didn't get any better, they'd probably have to amputate it. The reason the blister is there, the doctor said it's actually drawing the infection out of my foot. The white blood cells is working. She said if I had got burned and the blister wasn't there, then it would be a problem because the infection would be inside my foot and not drawing itself out. So that's why that blister is there, because my immune system and my white blood cells is working, actually pulling the infection out of my foot. The swelling that you see in it is because it's trying to pull the infection and everything out of my foot. But it's doing fine, actually. It doesn't hurt. It doesn't hurt. So it's actually better than what it was before.
What is your prognosis now after the treatment?
Well, I went back to her, and she said my white blood cell was working. That's good. So let me know my immune system is fighting the disease. And she said everything looked good.
So did they feel like there's a big reverse in your condition?
Right.
And has there been any change in your glucose level?
A little, not much. A little, not that much. But usually when I don't take my insulin, I get really sick. That haven't been the case. When I do take insulin, it makes me sick. It causes me to swell, so I don't like taking it. But since I had the treatment, I haven't taken it at all. I just commend Sam what he's doing, because I think more people should know about it. I've been doing a lot of studying about diabetes and their treatment, and still it's helping the patient. It's actually hurting the patient.
Do you have any specialists, or do you just go to one doctor, one diabetic doctor?
She's a specialist.
She's a specialist. Mm-hmm. What type of doctor is she?
Dr. Catherine is, I can't think of it. She was my surgeon too.
She was your orthopedic surgeon? Okay.
Yeah, she was my surgeon.
Was she the one to recommend that you might need to have some sort of amputation should the disease continue to progress? Mm-hmm. Yeah, so she should be very impressive.
She is. She cared a lot about me, but she was just kind of stung because nothing they tried was working, and it upset her. So when I went back, she was like, she's just amazed, like, wow, what are you doing? And I'm like, nothing really. I'm basically doing the same thing. And she's ecstatic, really.
How is your health now in comparison to before you received the treatment?
It's better. It's much better. I don't have as much infection or mucus buildup, so it's a lot better.
Okay, and as far as walking, because I remember we were discussing you were having a problem walking. How's that? How are you walking?
I'm walking in my heels, but I can walk up steps now and not having any complication with that. So it's better.
Okay. And what do you contribute the change to?
Well, I believe that the treatment helped me a whole lot, and and he was telling me to continue to eat, right, and I try to stay away from pork. I don't eat pork or a lot of beef. So I think the treatment is what really, helped the blood circulation in my body.
So were you taking any medications or with the insulin on a regular basis before you received the treatment?
And I was always sick.
Wow. So you were taking the insulin every day?
Every day.
How many cc's were you taking?
In the morning I was taking 30. At night I was taking 40.
Wow. Okay. And as of now,
I'm taking.
You don't take any. Period. Have there been any change in your glucose level since the treatment?
Yeah. Usually when I go to the doctor, it would spill over my urine and they could see it. Not anymore.
Okay. Would you recommend this treatment to anyone else?
Sure. I would.
And the reason being?
It helps. It helped me. I can just say that. The circulation in my leg, other physical illness that I was having, complication like the mucus. My eyes were just filled with a lot of mucus and I couldn't see. But ever since the blister bust, it just seemed like it just kind of took all the mucus and everything out. So I would have recommended to other diabetic patients. I've had surgery on my foot before the treatment, and it was that at that time they was thinking about amputating this foot, and the Lord saw me through that. They did not take my foot, but I think the treatment would keep down a lot of surgery, a lot of amputation, because it causes I noticed one thing with the treatment: it causes the blood to flow like it should. It also keeps down a lot of infection. Diabetics get a lot of infection. And I've had surgery on the back of my neck, which was very painful because they couldn't put me to sleep. And they actually thought if I went to sleep under the drug that I could actually die. So I had to deal with all that. And I just think that if they try it, people wouldn't have to go through so much pain and agony with this disease.